Hey WHCA WiCAL members, John Vander Meer, Executive Director here with Kate Dickson, our Director of Reimbursement Policy. Wanted to share with you some information about the 2018 workforce survey that we're in the process of completing and will be distributing to the membership in the coming weeks. Nearly 800 respondents responded to this particular survey, and this is the second collaborative effort that WHCA WiCAL has done with all of the state's long-term care provider associations. Certainly thanks to all of our members who responded to this survey and participated. And I think that it really yielded some interesting, if not some sobering data about the status of the workforce crisis here in the state of Wisconsin. Kate, could you go over some of the top line elements that were yielded from the survey?
Sure. So I think the most important data point in the results so far show that 1 in 5 caregiver positions are unfilled. Nearly 50% of providers feel that they're unable to compete with other employers. 83% of providers said there are no qualified applicants for vacant caregiver positions, and 55% of providers said insufficient reimbursement doesn't allow them to increase wages at this time. And another important point is 25% or 1 in 4 providers had to limit admissions.
Kate, as you know, one of the major challenges that providers face is the issue of reimbursement, both from the standpoint of skilled nursing facility, Medicaid fee-for-service, and family care funding. The limited funding that's available for the state's family care providers and for skilled nursing facility providers creates challenges in our providers' ability to compete with other employers in the marketplace for skilled labor. And what are some of the data points that surround that aspect of why there's a crisis?
So 1 in 3 respondents in our survey this time around replied that they are in markets where local non-health care competitors are paying a starting wage of $13, and that's compared to the median for our respondents with a starting wage of only $11, so $2 over that starting wage. They also responded that 4 out of 5 caregivers who left and took jobs outside of healthcare left for better pay, better benefits, and better hours.
So with the limited access to reimbursement, our providers and the provider community are forced to be in a position where they're not able to offer more competitive benefits compared to non-healthcare providers. Kate, can you go into some of the data points surrounding how providers are coping with this workforce crisis?
Sure. So our data shows that 75% of providers do not offer health insurance to their part-time employees. And 1 in 3 providers estimated that more than 10 of their staff were on Badger Care.
I think one of the important things for us to focus on here too, as we look back at our advocacy efforts in the 2017-19 biennial budget, is the significant gains that we made in that budget. $110 million between family care funding and skilled nursing fee-for-service funding over the cost to continue is an important stride we've made as a result of the efforts of not only the provider community, but the action made by Governor Walker and the legislature. But I think it's important for us to also realize and remember that an inflationary adjustment in terms of the provider reimbursement for family care funding and for skilled nursing fee-for-service Medicaid funding is not going to solve this crisis. We need to be looking toward skilled nursing facility payment reform and long-term care funding reform to really address these challenges. Well, thanks, Kate, and thanks to all of our members for participating in the long-term care workforce crisis survey this year. It's campaign season coming, and with legislators back in their district, we would encourage you to share the workforce crisis report that should be coming out in the coming weeks. Thanks so much.